Good afternoon. I'm Chiara Clayton with the Area Agency on Aging 1B, and today I'll bring you our presentation on 5 things caregivers should know. I am the Communication and Outreach Specialist for the Area Agency on Aging, and I'm very excited to be able to share this information with you if you're a family caregiver watching, caring for an older adult, or if you know of a caregiver, or if you're a senior being cared for by a family member. This presentation will give you some really good information and tips to help you be a better family caregiver. Alrighty. So what is the Area Agency on Aging 1B? So we provide access to local programs and resources for older adults and caregivers, including government-funded programs, and I'll go over that a little bit later. We also provide local delivery and administration of federal, state funding allocated for seniors. So we were created by the Older Americans Act in 1965, which pretty much sets aside government dollars to be put to all communities to make sure that services for older adults are done. We're a national network, so my agency is one of over 600 in the nation and one of 16 in the state that provide services for older adults and family caregivers. So that means no matter where you go, where you live, if you know someone outside of the Monroe County area, there is an Area Agency on Aging 1B to service them. The 1B is an indicator of our geographic area as far as where we cover. So our agency covers the counties of Monroe, but then also Oakland, Macomb, Washtenaw, St. Clair, and Livingston counties. So again, we're a national network, 16 in Michigan, 600 across the country. No matter where you go, there is an Area Agency on Aging to service you and to make sure that you're provided with resources and connecting to services in your area for older adults. So some of our services include a free senior help telephone line and referral line, government programs that provide in-home care. We actually promote two in our area, 2 in-home care programs that are provided through government dollars to help older adults remain at home, but getting those services that they need to be able to live independently and also to assist caregivers. Medicare Medicaid Assistance is also one of our programs. It's called MAP for short. We fund locally run programs like Meals on Wheels, provide a lot of funding and management for that. We also offer free health and wellness programs for older adults that I'll talk about a little later. And then of course, support for family caregivers. So if you're caring for someone 60 and older and you're in need of things like Meals on Wheels options, transportation options, referrals to in-home care, referrals to adult day services, anything that you may just want to see if it's available for the person you're caring for, we want you to give us a call so that we can help to refer you and connect you. So how to contact us? We have an 800 number, which is the front door to our agency. That's 800-852-7795. It's toll free Monday through Friday, 8 to 5. You'll talk to someone live, and it's a helpline for seniors, adults with disabilities, and family caregivers. And then we have our website, which is aaa1b.org. We keep it updated regularly with good information, information on services, information on caregiver support groups, adult days. You can sign up for our Care Hub newsletter, which is specifically for family caregivers, and a host of other things that you can find. We have a page dedicated just to Caregiver Resources. It's broken down by county, so you could also search for information specific to Monroe County. But again, this is how you can contact us, 800-852-7795, or on the web at aaa1b.org. Okay, so if you happen to know anyone that lives in Wayne County, again, the agency that I'm with, 1B, covers everything outside of Wayne County in Southeast Michigan, including Monroe. But if you know of someone in Wayne, there's 2 Detroit area agencies that cover Wayne County. One is DAAA, or Detroit Area Agency on Aging 1A. They cover Detroit, and then also Hamtramck, Highland Park, Grosse Pointe, and the Harper Woods area. Then there's Senior Alliance that covers everything else in Wayne County. They both have numbers that you can call to connect with them. And even if you happen to call us and you live in one of those 2 counties or anywhere else, we can connect you with the agency as to where you live. But we do have 2 other in Southeast Michigan that cover Wayne County. Okay, so let's get into the information that we're here today to get. So we know that caregiver challenges usually equal stress. So it could be very stressful if you're caring for someone full time on top of caring for yourself, for your children, for your spouse. So that's why you really need a plan. So just a couple of facts that we know. 52 million Americans provide care for chronically ill, disabled family members and friends. With that, caregiving can be very rewarding, but also be very stressful. Caregivers often don't know about programs and resources available to them, like the Area Agency on Aging. So we're trying to do a better job at getting information out so that caregivers out there know that there's options to turn to. Many try to do it all without asking for outside help or support. Many caregivers are trying to balance caregiving, a job, managing their own household, and raising children. Caregivers often feel like they're on call 24/7, and caregiving can cause some family conflict and resentment. So all of this equals to stress. So this is why you need to make a plan if you're caring for someone, if you are a full-time caregiver, or even part-time, for a family member, you need to have a plan. So hopefully this will help you to kickstart that plan if you haven't already. So again, don't be like this zebra, which is, what stress can do. So if this is you, and if you're a caregiver, it's probably stress. So we're gonna hopefully give you some information today that can help you to not have this be you. So what can you do? Caregiving isn't easy. Every situation is unique and there is no magic bullet. So you need to really understand that and internalize that. But there are steps that you can take to feel more in control. So that's what we're going to talk about today. 5 steps that you can take to be a better caregiver. So these steps are going to include assessing the situation and building a thorough understanding of your patient, of your parent or loved one's condition and needs. Also, learn what organizations and agencies are out there to help you, build some knowledge around legal issues related to caregiving, find some outside help so that you can take an occasional break and not feel bad about it. And then find ways to take care of yourself. And as you see, this is underlined. This is going to be the last bullet point because it's very, very important that you're taking care of yourself while you're taking care of that person who needs you. Because if you're not good, then you're not going to be able to be any good to them. So step 1, assess needs and build knowledge. So you want to assess the situation and build a thorough understanding of your parent or loved one's condition. So you're going to have to become somewhat of an expert on what they're dealing with to really understand how to be the best caregiver for them. So you want to assess where they are now and then also try to take a look down the road to see what needs you may need to address later on. So knowledge is power. That's a saying that we hear about a lot of things, but really as you're being a caregiver, it's really going to come into play where you really need to understand and build knowledge. So what is the person that you're caring for? What are their specific needs right now? What type of things may they need help with? You will need to make a list. How are their needs likely to change over time? How will their condition progress over time? Will their condition change their cognition or their behavior? Will they be able to stay where they are living now, a year from now, 2 years from now, 5 years from now? So you need to really think about all this as you're building the knowledge for how to really care for the person that you're caring for. So you want to talk to your loved one's doctor. So that's first and foremost. So you want to start attending doctor's appointments, talking to your doctor, asking for information or resources about your loved one's condition. And also so you can get a better understanding of what they're dealing with. You also want to contact disease and condition association. So I listed a couple that are kind of general to what we see at the Area Agency on Aging, but many of these groups exist. A quick Google search will probably help you. But a lot of them have literature, helplines, classes, and support groups specific to the condition that the person you're caring for has. So organizations like the Alzheimer's Association, Parkinson's disease, and American Cancer Society. These are nationwide organizations that also have local chapters or local offices, but you want to start with them as well so that you can also get specific information and help if your loved one is dealing with a chronic disease. If general aging is the issue rather than something specific, you may want to look at a geriatric assessment, and you want to talk to your doctor or to your loved one's doctor about setting that up, a geriatric assessment. So this is something to help you to be able to build knowledge on what the person is going through that you're caring for, to help to build the knowledge of their situation. So step 2, find organizations that can help you. So I'm a little biased, but there's awesome organizations out there like the Area Agency on Aging 1B. I always lead with us, but there's tons of good organizations that can assist you as you're going through your caregiver journey. So what organizations, institutions, and programs are out there to help? So I just listed a couple of ones that we see regularly with, in our experience in helping older adults. So of course, any of your area agencies on aging. And if you happen to be watching this and you live outside of Monroe County, where this is being shown, just know that we're a national organization. So Area Agency on Aging 1B covers 6 counties, but if you happen to know someone, or if you're someone watching that lives outside of Southeast Michigan, that lives in just the state of Michigan, that lives anywhere else outside of Michigan, there is an Area Agency on Aging to assist you. Disease-specific organizations, we just went over those. I listed these 3, but there's tons of organizations specific to chronic diseases or situations and conditions that you can also get information from. Places of worship and church. So most churches have a senior ministry. And even if they don't, churches are usually the hub of the community, since of course the church is made up of community members. So they may have volunteer caregiver programs, companionship programs, or just resources that can assist you. So check with your place of worship, check with your church if you belong to a place of worship in the area, and see what they have. And if they don't, you may want to mention that they may need to start some type of program. VAs, or Veteran Administration Association. So a lot of our older adults, older adults can be veterans as well. So VAs are also a great place to look if the older adult that you're dealing with has served our country. So you want to make sure that you connect with the VA. They partner with a lot of resources, including area agencies on aging, in the community to assist the veterans that are attached to the VA. So you definitely want to make sure you check them out as well. And then of course, senior centers. And I'll even throw in libraries as well. So, because I know that like this presentation is being given by the library system in Monroe County. So senior centers, libraries, a lot have resource advocates. Some may offer transportation options. Some may just be a hub of that information that you may need for your older adult. So check out your local senior center, Parks and Rec, or your library. So these are some organizations that can help you find resources. The Area Agency on Aging 1B offers a ton of caregiver resources. Again, going back to that 800 number, 800-852-7795, or on our website at aaa1b.org. One thing we offer is what we call our Connect book. So Connect is a wonderful resource guide. It's a nice amount of information in it, but in the back it's broken down by county, by resource. So it's available for free. We can send one out to you or send you out a box if you like, or it's downloadable on our website. But it's a wonderful book. It's a guide to long-term care options and many other resources in the 6 counties that we cover. We also offer caregiver classes. Our powerful tools for caregiver classes are virtual right now. So it's a 6-week class that you can take for an older adult. If you're caring for an older adult, I'm going to talk about the classes we have going on right now a little bit later. Referrals to adult day centers. If you've never heard of an adult day center, those are literally weekday care centers for older adults who can't be left alone and unsupervised due to things like dementia or just an inability to care for themselves. They can assist a caregiver who has to work, who has other obligations during the day to make sure that your loved one is taken care of. We can refer you to those in your local area. True also is an online educational portal for caregivers specifically caring for someone with Alzheimer's or dementia. And then we also offer a Care Hub newsletter that we send out once a month with lots of good resources. It comes right to your inbox, resources and information for caregivers. All of this can be found at our website at aaa1b.org under the Caregiver Resource section. So step 3, build knowledge around legal concepts. So this could be a presentation in itself, just the legal aspect of being a family caregiver, but just know you're gonna have to understand options and become familiar with legal concepts and documents that caregivers may need. So what is that? So these are some of the documents you may need. Durable power of attorney, healthcare power of attorney, last will and testament, living will, living trust, a caregiver contract, which establishes how a loved one providing care will be compensated if that's an option. There is situations out there where that is an option. This can help avoid payments to loved ones being classified as gifts if your loved one applies for Medicaid down the road. Now, Medicaid is a type of insurance usually for a lower income person that some older adults can qualify for, even in addition to their Medicare. For that, we have a program called MAP. It's Medicare, Medicaid Assistance. If you need help understanding your older adults' coverage, if they need help understanding their options, what's covered, what's not, if they qualify for Medicaid and Medicare, whatever that means. So that is something that we can assist you with if you contact us and get connected with one of our MAP counselors through our 800 number. But these are some documents you may need to understand as a caregiver and understand that you may need down the line. Also, if need be, you can work with a certified elder law attorney to help you build an understanding, explore options, and draft needed documents. So we do offer some elder care referrals through our 800 number if you need to be referred to elder lawyers, things like that. Or if you happen to know someone else has referred you to one, that's great too. But you may need to think about other documents and forms that you may need to interact with medical and other professionals on behalf of your loved one. So if you take over full guardianship, conservatorship, things like that, you need to understand what that means. If you're going to be able to speak on your loved one's behalf with doctors, hospital staff, banks, housing, if that's going to be a need down the line, you need to make sure you get with a certified elder law attorney to understand what all that means and what you need to do. You need to know where important documents are. So you need to know where mom, dad, grandma, neighbor next door keeps all of their important documents, their passwords, safes, take stock of anything that may be missing, keep a file of documents so you can produce it when needed. So you need to have this conversation with the older person that you're caring for in case down the line you have to find and know where those important things are. So again, this is the third step, an important step, especially as you go along with caregiving. If your older adults situation may worsen and you may have to take more responsibility, these are the things you need to know. Also, know and understand the CARE Act. This is in Michigan and many other states. That's Caregiver, Advise, Record, Enable Act. This requires hospitals to record the name of the family caregiver on the medical records of your loved one, inform the family caregivers when their loved one is to be discharged, provide the family caregiver with education and instructions if medical tasks he or she will need to perform for the patient at home. And you need to understand and know about hospital admissions versus observation with Medicare. So again, CARE Act, something you need to make yourself familiar with. This is kind of just a basic breakdown of what that is, but just understand this is something that is available in Michigan. Other states may offer it as well. Okay, so step 4, finding outside help. Caregiving is a marathon and not a sprint. Okay, so no one person can do it all, no matter if, Of course, you love mom, you love dad, you love grandpa, but you need a team of people. That's family, that's outside organizations, that's your loved one's medical team. You need a team to really make sure that person is getting the best care. Outside help will also let you rest, recharge, so you can continue. So that's what this next step is all about. And here's a visual for you. On the left-hand side of the screen is the sole caregiver approach. As you see, it's a sad little stool with one leg that's laying down. Um, so if this is you, a caregiving plan solely built around you is likely to have trouble. So it's hard for a one-legged stool to find balance. On the right-hand side, the team approach that pulls in outside support. So you have paid outside help, which we'll talk about, and then you have your friends, family, church, volunteers, and everybody else is that other leg. As you can see, adding other support helps keep everything upright, including you as the primary family caregiver. So how do you find outside help? What are options? So I talked a little bit earlier about two government funded programs that are available through the Area Agency on Aging 1B. So we promote two direct care programs that are funded through the state. One is called the Community Living Program. The other is called the My Choice Waiver Program. Both are for older adults. One is for 60 and up, which is CLP, Community Living. The other is My Choice, that's for someone 65 and up or 18 and up with a disability. But both provide services in the home that the person would usually have to go to an outside home, nursing home, some type of other home outside of what they're used to, their own home, to receive these services. And the services are brought in home. So it's a lot of information as far as the qualifications, but just know you can call 800-852-7795, which is our 800 number, to go through the qualification process and see if your older adult may qualify for government funded programming. They're often wait lists, unfortunately, and they're designated for those with the highest need, financial eligibility requirements, etc. For My Choice right now, we're not running a huge wait list. It's about a 3 to 4 month from the time the person is deemed eligible to see them receiving the services at home. For the Community Living Program right now, we are not accepting enrollments, but that may change. So I implore anybody out there who is caring for an older adult to call our 800 number and see if the older adult qualifies for one of these two programs. Or even if they don't, we can possibly refer you to some other programs. 800-852-7795. Paid caregivers or home care agencies, they help with bathing, dressing, personal hygiene, respite for you, the family caregiver, and also companionship. Again, through our 800 number, we can refer you to in-home care programs right there in Monroe County, in-home care agencies, excuse me. If you don't know which ones are available, you can call us at 800-852-7795 to get referred to home care agencies. Same thing with adult day programs, regular respite care, engagement for your loved ones. Some offer sliding scale pricing. You can visit our website at aaa1b.org for a list of adult day options, or call our 800 number. I'm going to keep saying it. You're going to get sick of me by the end of this. 800-852-7795 to get referrals within Monroe County to adult day programs. Friends and family, don't be afraid to ask and be specific with what you need. Ask your sister, ask your aunt who keeps calling, asking how they can assist with caregiving. Neighbors, friends of the person that you're caring for, your friends, people want to help you. They want to be a part of it. So don't be afraid to make that ask, but be specific with what you need. And when people step up to help and they offer it, take them up on it. Again, we talked about places of worship, your churches, your synagogues, anything as far as your place of worship, your church community, also great places to find outside help. And then also Meals on Wheels. It is an Area Agency on Aging funded program available to homebound seniors 60 and over. It can also offer additional support beyond meals. So you can call our 800 number to be connected with Meals on Wheels in your area, 800-852-7795. So if you're hiring a home care agency, just want to touch on this. There's some specific questions as a caregiver that you need to make sure you're asking before you're hiring an outside agency to come into your home and care for your loved one. These are just some tips that we want to give you if you're looking and you're kind of shopping around for a home care agency. How long have they been in business? Do they have experience with specific conditions? How do they train their staff? What hour minimums do they offer? So minimum amount of time that they'll offer care. Are they bonded? Because there are differences between a bonded home agency and a non-bonded. Do they drug test? Do they do background checks on their staff, and how often? What happens if a regular caregiver that they have set up for someone can't make it? How do they find someone who is a good fit for your family? What do they do if that caregiver is not a good fit? So these are some of the questions as a caregiver that when you're interviewing these home care agencies, these are some questions that you should be asking to make sure you're getting the best agency for your family, for your loved one. So now, ask family members for help. We talked about that, but be specific with what you are asking. Keep a list of what is needed. So if someone calls or if someone offers and they say, hey, what can I do to assist? You have a list of what's needed. When people call and ask if they can help, say yes and hand them an assignment. Don't think they're doing it just to be polite. They really want to help. Also, keep it positive. Like in anything, positivity will usually take you a lot further than negativity. And this situation is no different. Stay away from saying to someone, you never. It's easy if you're feeling overwhelmed, if you're feeling like people aren't really stepping up to say, you never offer help, you never do anything for mom, you never do this, you never do that. But don't do that. Instead, say, you're really great at, and then fill in the blank, and then say, can you, and fill in that blank. That's a much more positive way to reinforce that person that they're good at it, and then also to make that ask. And then play on the strengths of what the person is good at. Are they a good cook? Are they a good handyman? Are they a good companion? You know, do they play a mean game of Uno and they can actually hang out with the person you're caring for and play some Uno? But play on the strengths of the person that's asking for help. And when they ask, take them up on it. Make it about your loved one. Remember, it's about them and not about you. Even though you may feel you can do everything better than everybody else, you want to make it that everyone feels a part of it. And you want to make it that it's all about the loved one that you're caring for. So last but not least, step 5, practice self-care. Self-care is just not a hip buzzword. Self-care Sundays, hashtag self-care Sundays. That's really a thing on social media. But no, self-care is really a thing, a good thing, especially if you are a caregiver, because caregiver burnout is real, y'all. It's real. You cannot take care of anyone else if you don't first take care of you. So this is what you want to make sure is the final step in your prepping to be an awesome caregiver. So warning signs of burnout or unsustainable stress: anger and resentment, social withdrawal, anxiety, depression, exhaustion, sleeplessness, emotional reactions, health issues, eating too much or too little, feelings of hopelessness and helplessness, burning that candle at both ends, like we see on this picture. Not a good thing. So if this is you, you are burnt out and you need to take a break. So how do you do that? What can you do? First, take a class. So again, the Area Agency on Aging 1B offers an awesome class called Powerful Tools for Caregivers. You can go to our website to see when our next class is. I actually have information for you on the next slide. Or you can call our 800 number, 800-852-7795. Powerful Tools is a 6-week class. Right now it's being offered virtually or on the platform GoToMeeting. But it's a wonderful class. You get lots of good resources. It's small, so you can really get that hands-on experience and benefit from a small class. You get some good resources, and you're also able to really connect with and talk to other caregivers in addition to the trainers. So that's a wonderful class to take outside of some other awesome classes that are out there. The library may offer some other, some of those support groups may be out there through some of those organizations that deal specifically with a chronic disease or situation. So just find a class, take a class. Also find a support group I just mentioned. So on our website, we list by county support groups that are available to caregivers. So if you go to aaa1b.org, look under that caregiver tab, you can find support groups. You can also call our 800 number to be able to find support groups. Find regular respite care to take some time for you. So that was part of step 4. Asking family members for help, going to your place of worship, adult days, finding that, bringing in a home care agency to be able to give yourself some respite. Find time to do something for you every day if possible. Usually when I say that, someone says that's kind of hard if you're a caregiver, which we know, but that could be something small like watching your favorite TV show, trying to find time, reading a chapter in a book every day, taking a walk. Thankfully, I believe summer is here, everybody. Thankfully. So taking a walk outside, but just try to do something for you every day, even if it's just taking 5 to 10 minutes just for yourself to do something. And then have realistic expectations to be kind to yourself. We're all doing the best we can and everything. We've had a crazy year through a pandemic, through situations in the last year. You add caregiving to that, it's been a time. But just know and tell yourself every day that you're doing the best you can, that you're going to get up every day and give it your all with everything that includes with being a caregiver. Be kind to yourself and be realistic with what you can do, and take it day by day and do what you can with what you have. So with that, I want to definitely shout out our virtual wellness workshops that we just announced coming up for the next couple months through the summer. So we offer an array of classes, as you can see here, but I want to hone in on the Powerful Tools for Caregiver class, which is the 6-week course that we offer. Right now, we have a session that's going to be starting on June 10th. There's going to be an orientation on June 3rd. June 3rd is a Thursday, but the class is going to be a 6-week class starting on June 10th. And it's going to go through July 15th, once a week from 1 p.m. to 2:30 p.m. Okay, the orientation, which is going to pretty much help you to understand, go to meeting and just get any questions that you have answered. It's optional, but it is available, the orientation June 3rd, which is a Thursday at 1 p.m. So we have a second session for Powerful Tools for Caregivers coming on, it looks like the workshop begins July 21st and it goes through August 25th. Again, 6 weeks. This one's in the evening from 6 p.m. to 7:30. The orientation for this session is going to be Wednesday, July 14th at 6 p.m. It's optional. But again, that's going to be an evening option for you. That's going to start July 21st. And then we have another workshop that begins on August 9th. And it's going to go through September 20th. It's in midday, 11 a.m. to 12:30. No class will be given Memorial Day weekend, which is September 6th. So we have 3 upcoming Powerful Tools for Caregivers 6-week sessions coming. First one starting on June 10th through July 15th. Second one, July 21st through August 25th. Last one, August 9th through September 20th. You can call 833-262-2200 to register for these classes. Registration is required. You can also email wellnessprograms@aaa1b.org to register for any of the classes or get any questions answered. This is also on our website at aaa1b.org. But I implore any caregiver out there that's looking for an awesome class to connect with our powerful tools for caregiver classes. 3 sessions coming to you this summer. Last but not least, the Area Agency on Aging 1B is here. Woo, woo. We are in the community, everybody, and we have been helping seniors and their families for over 45 years. Call our 800 number, 800-852-7795, or visit our website at aaa1b.org. We offer everything. We are a nonprofit, just in case you didn't know, focused on supporting seniors, offering services to their caregivers, things like referrals to in-home care, Meals on Wheels, transportation, housing, supporting family caregivers, caregiving, educational classes, health and wellness, Medicare counseling, and much, much more. So please connect with us, call us. We are here for Monroe County, in addition to the other 5 counties that we cover. If you're watching this from outside of one of the 6 counties we cover, you can still call us. We can connect you with the local agency as far as where you live. Also, last but not least, we are on social media. So if you happen to be on Twitter, Facebook, Instagram, or LinkedIn, connect with us, all under Area Agency on Aging 1B. We have a lot of good content that we share from us, but then also from a lot of our partners, like the Monroe Library System, that, as far as information and resources that they may provide as well, in addition to other local agencies. So again, I usually take questions if this was live, but if you have any questions, call our 800 number, 800-852-7795. Again, Area Agency on Aging 1B, here to support family caregivers, here to support older adults, 60 and older. Caregivers out there, what you do is sometimes not championed like it should be. Sometimes you may feel alone. Sometimes you may feel overwhelmed. Sometimes you may get a little stressed. But just know what you do is so rewarding and so needed. The person that you're caring for thinks the world of you. Just know that. But just know that you can take some time for yourself, not feel bad about it, recharge yourself so that you can be there fully for that person. And know that we're here for you. Area Agency on Aging 1B is here. Finding other outside entities to help are also a good idea. But just know, have a plan. Start with these 5 tips. I'm going to go back really quickly to make sure you understand what those 5 tips are. Let me go back to that slide that lists all of the 5 tips so we can just end on that. Hold on. Let me see here. 5 tips. Here we go. So I'm going to pull up this slide, and this is how we're going to end. So just remember, assess the situation and build a thorough understanding of the person that you're caring for's needs. Learn what organizations and agencies are there to help you. Build some knowledge around legal issues related to caregiving. Find some outside help so you can take an occasional break, and find ways to take care of yourself. Those are 5 steps every caregiver should take. And I hope this was beneficial. Again, I am Chiara Clayton with the Area Agency on Aging 1B. If you need me, you could reach me directly, 248-320-1144. Thank you so much for this opportunity to present. And we'll see you next time at the next presentation. Thank you so much to the Monroe County Public Library System. I hope I'm saying that correctly. I believe that's the full name. Thank you for this opportunity to present. And we'll see you later. 800-852-7795, Area Agency on Aging 1B. Thank you so much.